Welcome to our three-part web series called Healthcare Transitions. Our mission is educating you on the power of using experts to help you decode Medicare, long-term care, and to navigate our healthcare system. When you are empowered with accurate and efficient information, you can protect your family well, you can spend your healthcare dollars well, and remain calm and confident in your daily lives. The group of experts we have for this series include Bridgett Skelton, MBA, RN, BSN, RNCOB of CaraVita Senior Care Management, and we'll also hear from Keith Knabb of Affordable Medicare Solutions and Cherish Delacruz of Delacruz Law in our upcoming segments. Each expert will highlight one area of information in each 20-minute program. Today, we will hear from Bridgett Skelton on the benefits of primary care during a pandemic. Bridgett Skelton has been helping families and seniors for over 15 years to navigate the healthcare system to improve their healthcare outcomes. Our healthcare system is not one size fits all. Individualized and person-centered care is imperative in improving outcomes. Bridgett, please introduce yourself to our audience.
Hi, thank you, Keith. Good afternoon, everyone. As Keith mentioned, I am a registered nurse, and I'm here to focus on the benefits of primary care in preserving our health and improving our outcomes during a pandemic. So we'll begin. The company I work for, I'm the Vice President of Business Development for CaraVita Senior Care Management. We are a management company for assisted living communities as well as a home care company. Beth Casey, as you see pictured here, is our founder. She is a physical therapist and dementia care specialist. She is also our CEO and founder. We have an interdisciplinary team on our leadership team. So from left to right, myself, Bridgett Skelton. Lori is our Vice President of Clinical Operations, and she is also an RN. Laura Casey, who is a licensed medical social worker and geriatric care manager. She is our Director of Care, and Bear Mahon is our President and Chief Operating Officer. So today we'll be discussing the benefits of primary care. So we hear a lot about the word PCP, primary care provider, and so let's dive in a little bit deeper on what the benefits are of this service. A primary care physician is essential in helping an individual navigate the healthcare system. So we like to say that they are really the primary one that is going to help guide you, determining your risk factors and to determine whether you need to follow up with a specialist. They specialize in preventing diseases by identifying certain risk factors and coordinating and managing chronic condition management for longevity and quality of life. And that's especially important right now as we talk about the underlying health conditions that may put someone in a high-risk category. If those conditions are well maintained and are under control, the risk dramatically lower for the individual. Primary care physicians develop a baseline for your well-being and really get to know you and your family. This allows for optimal management of your condition. So by that regular follow-up and that established rapport, the physician or nurse practitioner is really able to determine what would work best for you. Because as Keith mentioned in our opening, it's not a one-size-fits-all. So there are pros and cons to different scenarios. For instance, you may have the inability to take a certain medication because it interacts with another medication that you're taking. And if you don't have that primary care provider and all you have is a group of specialists, then they are not looking at the medications from a comprehensive approach or a holistic approach. So that primary care physician will look at those medications, take a look at interactions, and determine whether anything that you're taking is going to interact with the other medication or doubling up on medications in some cases, or may have a negative impact on a certain diagnosis that you have. So having a regular primary care doctor is very important for that reason. It also remains important and essential even during a pandemic. Remember, primary care reduces the risk for those who fall into the high-risk category, as we mentioned, with comorbidities and with COVID-19. So as we talk about comorbidities, we understand that those diseases and disorders, like I was saying, can have an impact on negative outcomes. But if they are well controlled, it does lower your risk to that with someone without that diagnosis. So there's various types of primary care providers. So family medicine doctors, they care for the whole family in a variety of areas, including gynecology, pediatric, and internal medicine. Internal medicine physicians generally care for adults treating with a wide variety of chronic conditions. So that's typically what your adult population and older adult population will follow up with internal medicine doctors. Pediatrics is also a form, of course, of primary care. So they are compassionate, hopefully, especially if they're dealing with children, and provide personal care for children for birth to 18 typically. And then adolescent care, this may surprise you that it actually extends out through age 30, which I thought was very interesting as well. So that is due to all the growth and development that happens during our 20s and things that need to be managed for adolescents and to ensure proper milestones are being met and so on and so forth. In today's world, as we have moved with we're kind of coming out of some things now, but with the shutdown, a lot of providers went to telemedicine and telehealth. And I got to tell you, I really, from a nurse and a clinician myself, this is a really effective way to reduce the spread and as well as receive quality primary care. For instance, I actually did one of these virtual visits myself. I scheduled the appointment with my primary care provider who I had an established relationship with, and ahead of time they told me, can you please bring a blood pressure cuff? I had one that I bought from CVS or Walgreens that I was able to take my blood pressure during that recent weight. If you wear any kind of wearable like a Fitbit or an Apple Watch, you can also do your EKG on here to note whether it's sinus rhythm. You can check your pulse. So all of that data can be collected for your telehealth visit. The telehealth visits are really great because you can do a face-to-face visit with your doctor virtually, just like we're doing with the webinar, and they can get a really good sense of what's going on with a good family history, the history that they know of you, and just telling them what's going on. It is a very acceptable way to treat a condition without having to go to the doctor yourself. And they'll tell you during that telehealth visit if you need to come in for a face-to-face visit. So virtual care in the form of telephone and video has allowed physicians to continue treating patients while still adhering to social distancing recommendations. It's been a great way, and I think we're going to see more of that. Many home health and hospice providers have gone to telemedicine for certain visits that were not considered essential. And I don't think that we will see that necessarily change in the coming months and maybe even up to years to come. These types of visits are very effective for evaluating and counseling patients on a number of medical issues. They do have some limitations for preventative measures such as cancer screenings where you actually have to go in for a test. And so that's why I wanted to talk with you today about ensuring that you are following up. Women, we're following up with our gynecologists. Men, we're following up, with your primary care provider because these cancer screenings are very important. It is even more important for us to be at our heightened level of wellness right now. So making sure our proper nutrition, everything is under control right now because we don't want to be contributing to negative outcomes. Many hospital systems have seen a decrease in capacity. That was intentional, right? With the shutdown, we intended to reduce the capacity in the hospitals. But what we did not intend is for people to not seek emergency medical attention for emergencies and not continue to follow up with their physicians. So I've been on several calls with hospital systems and home health and hospice providers, and people have actually gone the opposite direction and have not sought medical attention for what could have been, they could have been saved for. So for instance, chest pain at home or stroke-like symptoms, being so fearful of going to the hospital really creates negative outcomes. So it's good to know your risks, know what to seek medical attention for, and not to avoid it when it's necessary. The role of the primary care provider in home health and home care. So I mentioned a moment ago about reduction in home health. Home health is the best in-home service that someone can receive. It's covered under Medicare, and primary care providers are the responsible party for managing the home health benefit. They write the order, they write the follow-up orders that Medicare has to go by, Medicare has very strict guidelines. They changed as of January 1. It's called PDGM, which is Patient-Driven Goals Model. And that means that they have very strict protocols that they have to follow for their orders, the way the orders are written. So if you don't have a good primary care provider, you may not qualify or even have the recommendation or have the benefit of receiving home health. Home health reduces the risk of going into the hospital. You can get a home health nurse coming out to your home, physical therapist, occupational therapist, speech therapist, and in some cases, even a certified nursing assistant. So again, that PCP or primary care provider will be directing that care for the home health company. Most physicians help determine and initiate home health services. They are also involved in identifying the specific home health services that the patient needs. Again, those orders have to be driven by the physician, including wound care orders. So let's say you have a wound and you need to have that healed in your home rather than going to a wound treatment center. That primary care provider will be writing the orders for the wound management. Over half report working jointly with home health agencies or hospital staff to determine if their services are needed. Also, careful coordination with a primary care provider and home care as well. So the company I work for, we're a home care provider, and we work directly with primary care providers all the time. That helps us guide the care plan and determine the needs of our clients. And that really improves outcomes. You know, as we talk about reduction of admissions to hospitals, and we're talking about unnecessary hospitalizations and unnecessary admissions. And that's the outcomes that we're really driving for. We're striving to reduce unnecessary hospitalizations and readmissions because they are directly related to negative outcomes for you as the patient. We know when we go in the hospital, we immediately increase our risk to come out with a hospital-acquired infection. And right now, we want to prevent contracting COVID-19 when we go into the hospital. So reducing that the risk for readmission is essential, and the role of the PCP and home care and home health can help do that. So again, what we do as a private home care provider in reducing this risk is our home care providers and home caregivers become a link between home health and the physician visit. And matter of fact, we have a partnership through our electronic documentation system that works directly with home health. So we can automatically report a change in condition. That change in condition alerts the physician and the Medicare home health company. So it really helps keep all eyes on the patient or the client, making sure that we even assess for subtle changes, lethargy, weakness, things that may not be a red flag for everybody every day, right? You may not even notice that on mom or dad or someone that you're caring for, but a trained provider will pick up on those changes. We assist with symptom management with the physician. So they're going to give parameters for things, congestive heart failure, the abbreviation of CHF there. You know, monitoring daily weight. Has there been a 3-pound weight gain overnight? If we're weighing our client every single day, or the telehealth visit from the home health nurse, because they can put a device in there that can also monitor the weight, we can reduce the risk of needing to go to the hospital because of a congestive heart failure exacerbation. Just something simple as monitoring daily weight. The physician can order additional medication that can bring some of that fluid off. Cardiovascular disease, Parkinson's, as we know, will decline if they go without continual movement. So keeping them on that home health benefit with therapy and under maybe Part B if they no longer qualify under the Part A benefit for therapy. Also, chronic obstructive pulmonary disease. We know right now, especially with COVID-19 being a respiratory disease, want to make sure we've got all those medications refilled, nebulizer medications as needed, inhalers, that we're staying in optimal respiratory health. Diabetes is also one of those risk factors where we can monitor the blood sugar. We can monitor making sure that the insulin is taken appropriately. And then, of course, Alzheimer's and dementia, a holistic approach to care for Alzheimer's and dementia. Ongoing caregiver activity. So these are just some things that we do under the home care services that we work with the primary care provider on to make sure that our caregiver is following along with what the primary care provider would like. So we make sure that they're following up with those appointments. We take them to and from the physician's visit if needed. We can also facilitate that telehealth visit. So remember, as we talked about staying out of the physician's office if needed, but still seeking that telehealth visit, we set up and coordinate that for our clients as well, because we do find that technology can be a challenge for our clients. So we can do that from the caregiver's phone as well. And we also always have nursing oversight. So every single client has the oversight of a registered nurse who checks in with the CNA, and then our nurse is the one that always reaches out to the primary care provider. So again, bringing back in that PCP. If a change in condition is reported, she reports it to the MD, so that he can order different medications if needed or other treatment options. And if your family is not nearby or not able to regularly be in the visit with your mom or dad or with their loved one, we also keep the family informed. And we've done creative things like Zoom for the families or FaceTime or just other virtual visits to include the family in that as well. I hope that you learned a lot about the benefits of primary care and how it can keep you safe and healthy during this time. If you have any questions, feel free to reach out to us. Our website is CaraVita.com, and I do see on here the Oversight. I should have put our phone number on there, but I can also include that information at a later time. So thank you.
Thank you, Bridget. That was very interesting and certainly timely information. Your professional service for families is a blessing during this challenging time. You can see this presentation on Bridget's YouTube channel, or we can send you these slides by emailing bridgetts@caravita.com. And that's Bridget with 2 T's. Also, Bridget has a wealth of educational material for free download on the CaraVita website, www.caravita.com, CARAVITA. In our next segment, we'll be educated by Cherish Delacruz of Delacruz Law, highlighting the practical tips to organizing your estate plan. You don't want to miss her excellent information. Thanks for viewing today.